Governor, we have the plant with us for Garissa people. It was donated by USAID, yes. It has a service contract for 2 years. USAID will take care of that. What happens to the plant after 2 years? I'm sure you're up to the task to make sure that the maintenance is done, to make sure that the cylinders which have also been donated are well maintained and able to support other sites. I'm very happy that already I hear there are some sub-counties, hospitals, and level 3s receiving oxygen from this side. So let's continue working together to ensure that the health workers support the community optimally. Thank you very much.
So you can imagine traveling from Garissa 300 kilometers plus with cylinders, loading a bus or loading a GPO or a vehicle government official to actually go and look for this commodity. Now at our comfort zone, we are going to have this commodity available in Garissa, and I know we are also going to support the private facilities who are actually going for these commodities again 300 kilometers above. So ladies and gentlemen, in the last Kenyan decade, Kenyan health system has undergone significant changes. And we are always proud because we say devolution has brought success to some of the counties that have been marginalized. Some of us working in this facility, we know what we have been undergoing during in terms of HRH, in terms of infrastructure. I remember when Your Excellency, you took up your first assignment was actually to increase the number of human resources, and I remember you recruited 300 healthcare workers. And by then I was the hospital matron, and we were very happy because you've actually motivated us. And for you to actually have a motivated healthcare workers, you have to provide the resources for them to work, because that is also a motivating factor. Basically, since the onset of devolution, county government have invested in significantly in terms of strengthening health services and achieving good outcomes across all health system pillars. County government have progressively invested in health service delivery and rapidly expanded health infrastructure. So if you walk every 5 kilometers now, even in this county, and generally all the 47 county government, you will access a health facility, which was basically a challenge. Even in counties like Garissa, which were previously largely underserved, counties have boosted health products and technologies and stepped up health financing, despite the fact that Kenya's total investment in health is still under the 15% commitment set by Abuja Declaration. And Your Excellency, as we speak, among all the 47 county governments, when you look at the total health budget, all health sectors, in the health sector, 30% of their total budget of the county is actually going to health. And we keep on saying, please add, but we are going to be strained. But however, that is why we're having this partnership, and we want also our partners to support the county government. So as we work into this journey, ladies and gentlemen, have ambitiously propped up human resource for health. For example, between the financial year 2016 and 2017 and financial year 2020-2021, Your Excellency, the total number of healthcare workers in counties increased by 61% from 59.726 to actually 96, if I go cumulatively, and that is actually a success story for all the 47 counties. And if you really want to look at this data, you can just go into the state of devolution address and actually see some of this improvement, Your Excellency. I am really glad, and I know JPEGO, who are led by Rosemary, she's the one who was actually behind putting up this infrastructure, and as much as it is a contract, she needed all the effort. I know we've really pushed them to put this up in infrastructure. I know there are counties, there are other 4 counties that have benefited. Some of them now may not be able to launch. But I know as county government, we are the second actually launching this particular plant. And after 2 years, Your Excellency, we also need now to look into the sustainability, because the contract for USAID is just 2 years. After 2 years, now we have to stand on our own. So I think we also need to look into other innovative way of actually making sure that this plant is sustained, because it will last. It's a plant that can last between 12 years to 20 years if it's properly maintained. So thank you very much.
We as governors, we have spoken. I'm also a member of the committee. We have spoken, and we keep saying our national government, let them up their game regarding the mesh equipment. It should not be messy. They are the ones who procured on our behalf these machines or this equipment. They are the ones who undertook to maintain them. They are the ones who undertook to keep the relationship with the providers. And now we are in a situation whereby in a number of cases, the contracts have expired, the maintenance SLAs are no longer active, and nothing is happening. We have a situation whereby actually a number of machines have not been maintained for quite some time, and therefore are not in use. We are saying, the national government, if you have taken upon yourself that responsibility, Minister of Health, tafadhali mafanya kazi yenu. Don't make our life difficult. We are in remote parts of the country. We signed off those equipment. I signed off the equipment when I was doing my first term. And I did it in good faith because I wanted them for my people. If now you are unable to manage them, so we can look for alternatives. But we can't understand why we should be having in our facilities equipment that are not in operation or that are not maintained. And we don't even know who to go to, because there's no apparent good response from the ministry. That message needs to go, and I'm sure it's the same message that all governors have been saying regarding the MES machines, or equipment for that matter.